explaining all the information about heartworms in pets, symptoms and preventive measures, treatments, infectious diseases, etc. A pet dog can get heartworm disease by being bitten by an infected mosquito. Heartworms are long, thin worms that live in the heart, lungs, and blood vessels of affected dogs. Heartworm disease can cause a variety of symptoms in dogs, which may vary depending on the severity of the infection. The following are some of the common symptoms of heartworm disease in dogs. A persistent, dry cough is one of the earliest and most common symptoms of heartworm disease. The cough may become more pronounced after exercise or excitement. As the heartworms grow and multiply, they can impede the flow of blood through the heart and lungs, causing shortness of breath and exercise intolerance. Dogs with heartworm disease may tire easily and have less energy than they normally would. They may also avoid physical activity or become easily winded. Some dogs with heartworm disease may lose their appetite and have a decreased interest in food. Dogs with heartworm disease may lose weight due to a lack of appetite and decreased energy levels. In severe cases, the accumulation of fluid in the chest or abdomen due to heartworm disease can cause the abdomen to appear swollen. In severe cases, the accumulation of fluid in the lungs can cause a dog to collapse or have difficulty breathing. It is important to note that some dogs may not show any symptoms of heartworm disease, even though they are infected. That is why regular testing is so important, especially in areas where heartworm is common. Preventing heartworm disease in dogs is important in order to keep them healthy and free from this debilitating and potentially life-threatening condition. Here are some steps you can take to help prevent heartworm in your dog. One of the most effective ways to prevent heartworm disease is to give your dog a monthly heartworm preventive medication. These medications are available in the form of pills, chews, or topical treatments, and are designed to kill heartworm larvae before they can mature into adult worms. Your veterinarian can help you choose the best preventive medication for your dog based on their individual needs. Mosquitoes are the primary vectors of heartworm disease, so keeping your dog protected from these insects is crucial. This can be achieved by using mosquito nets, screens, or sprays, or by keeping your dog indoors during peak mosquito hours, dawn and dusk. Regular testing is an important part of preventing heartworm disease. Your veterinarian can perform a simple blood test to determine if your dog is infected with heartworms. If the test is positive, your veterinarian can advise you on the best course of treatment. Mosquitoes breed in standing water, so it is important to eliminate or reduce sources of standing water around your home. This includes removing stagnant water from bird baths, flower pots, and gutters, and draining pools or ponds that are not in use. A healthy weight helps to reduce the risk of heartworm disease and other health problems. Overweight dogs are more susceptible to heartworm disease, so it is important to maintain a healthy weight for your dog through a balanced diet and regular exercise. Regular veterinary checkups are an important part of preventing heartworm disease and maintaining your dog's overall health. Your veterinarian can perform a physical exam, test for heartworm disease, and check your dog's overall health to ensure that they are protected against this and other health problems. Heartworm disease is a serious condition that requires prompt and effective treatment to help improve the chances of a successful outcome. The following is an overview of the first aid and treatment options available for dogs with heartworm disease. If your dog is showing signs of severe heartworm disease, such as severe coughing, shortness of breath, or collapse, it is important to seek immediate veterinary care. In these cases, it is best to keep your dog as calm and quiet as possible to minimize the stress on their heart and lungs. If possible, transport your dog in a lying position to minimize the risk of fluid buildup in their lungs. Your veterinarian will perform a physical examination and may order blood tests, X-rays, and other diagnostic tests to determine the severity of your dog's heartworm infection. This information is important in determining the best course of treatment. The goal of adulticide therapy is to kill the adult heartworms that are causing the symptoms of heartworm disease. This is usually done with a combination of drugs, which may be given by injection, oral medication, or intravenous infusion. Anti-inflammatory medication is often used to help manage the symptoms of heartworm disease and reduce the risk of complications. This may include corticosteroids, non-steroidal, anti-inflammatory drugs, and SAIDs or other medications to help reduce inflammation and improve your dog's overall health. After adulticide therapy, it is important to restrict your dog's activity to allow them to recover. This may include crate rest or confinement to a small, quiet area. Your veterinarian will advise you on the best way to restrict your dog's activity, as well as when they can gradually return to their normal level of activity. Regular follow-up testing is important to ensure that your dog is responding to treatment and to monitor their progress. This may include repeat blood tests, X-rays, and other diagnostic tests to ensure that the heartworm infection has been successfully treated. After your dog has recovered from heartworm disease, it is important to keep them on a monthly preventive medication to reduce the risk of future infections. Your veterinarian can advise you on the best preventive medication for your dog, based on their individual needs. Treating heartworm disease can be a long and challenging process, but with prompt and effective treatment, many dogs can make a full recovery. It is important to work closely with your veterinarian to ensure that your dog receives the best possible care. Heartworm disease is a parasitic infection that is primarily found in dogs, cats, and other mammals. While heartworms can infect a variety of species, including humans, transmission of heartworms from infected dogs to humans is rare. Heartworms are transmitted to dogs through the bite of an infected mosquito. The mosquito bites an infected animal, picking up the microfilaria, baby heartworms that are circulating in the animal's blood. The mosquito then bites another animal, transmitting the microfilaria to that animal. In dogs, the microfilaria mature into adult heartworms that can grow up to a foot long and cause serious damage to the heart, lungs, and other organs. In humans, the possibility of transmission of heartworms is extremely low. Humans are considered dead-end hosts for heartworms, meaning that the heartworms cannot mature into adult worms in the human host and therefore cannot produce offspring. This is because the conditions in the human body are not suitable for the development and survival of heartworms. While heartworms cannot mature in humans, it is possible for microfilaria to be accidentally introduced into the human body through a mosquito bite. However, these microfilaria will typically die within a short period of time and do not cause any serious harm to the human host. It is important to note that while transmission of heartworms from dogs to humans is rare, humans can still play a role in transmitting heartworms to dogs. For example, if a human is bitten by an infected mosquito, and that mosquito then bites the dog may become infected with heartworms. In conclusion, while heartworms can infect a variety of species, including humans, transmission of heartworms from infected dogs to humans is rare and typically does not cause any serious harm. It is important to focus on preventing heartworm disease in dogs, as well as reducing exposure to mosquitoes to reduce the risk of infection. Thanks for watching.